today I'm filling in for Rachel to introduce our speaker for today, Lisa Harnack. Lisa is a professor and the interim head of the Division of Epidemiology and Community Health. And I think probably everyone knows who Lisa is at this point. She's also the director of the University of Minnesota Nutrition Coordinating Center. And Lisa has focused her research career on conducting studies to improve the scientific evidence base on which nutrition policies, programs, and practices are based. So today, Lisa will be speaking about her work looking at how we can use the FDA to improve public health through food regulation.
Thanks for that introduction. And I'm so glad you're here on a cold Valentine's Day. Happy Valentine's Day to you all. And we're going to give the FDA some love today. I'm going to share some of the great work they're doing and the ways that you can contribute to that science. The agency's needs of love right now. So, the idea for this seminar was spurred by a conference on nutrition regulatory science held this past December.
Is your mic on?
It is.
It is. I'm speaking into it.
I'm speaking into it now, but I don't think it's amplifying.
It's not.
I'll turn up the volume. All right, let me try it again. Are you hearing me now? I think Jeff is watching what's happening. So maybe, well, let me just switch to All right, now you're hearing me. Yes, okay, thanks for pointing that out. So I got this idea for the workshop because I attended a nutrition regulatory science meeting in DC in December. And it really opened my eyes to a lot of what the FDA does and the role that we play in their work. I have to say that when I was invited to speak at this meeting, and I actually didn't know what nutrition regulatory science meant. I agreed to speak, and then I was like, okay, I got to Google that. I must do it if I don't want to speak. And so now I'm going to give you the definition in case you're like me and you also don't know what it is. FDA defines regulatory science as a field of scientific research focused on developing the tools, standards, and approaches needed to generate the data and information on which FDA assesses the safety, efficacy, quality, and performance of FDA-regulated products. And as you're going to learn today, this encompasses a lot of research. You're probably all doing regulatory science research, and you just don't know it. So, and today I'm going to give like a primer on the role of FDA in regulating food, so you kind of understand what their purview is, and then talk about the importance of scientific evidence in regulatory decision-making. Share some nutrition regulatory success stories, which I think we all need to hear some success stories these days. And there's some real great success stories. And then give examples of the way research here at the U of M has been used in regulatory science, kind of biasly focusing on work that I've done with the Nutrition Coordinating Center. There's lots more work that's been done here at the U, but I'll be kind of focusing in on that. And finally, talking about how do you know what's a good research question to be asking and pursuing that's really going to be useful to the FDA. So we'll talk a bit about that as well. So what's the purview of the USDA for food? This is the mission of the FDA, and I've highlighted and read the sections that relate to food. The FDA is responsible for ensuring the safety of our nation's food supply, pretty big goal there, and also helping the public get the accurate science-based information they need to use medical products and foods to maintain and improve their health. So they have these two big things they should be doing around food. And when we talk about foods, it's a little more than just food. It also encompasses dietary supplements, bottled water, food additives, which we'll talk about in a bit, infant formulas, and then pretty much everything you're going to find in the supermarket or at a restaurant as well. There are some foods where the USDA plays a bigger role than FDA, and that's mostly commodities like eggs and meat and dairy, where the USDA has a bigger role than the FDA, but the FDA still has a role in those foods as well. Let's start with the safety mission. So they look at the safety of the food supply in three main different ways. One is the safety with regard to foodborne outbreaks. So making sure that food isn't going to cause a foodborne illness. And just last week, I think the FDA issued a recall of over 2 million donuts because of potential contamination with listeria. So that's an example of that role. They also have a role in making sure the packaging that food is packaged in and how it is in cookware used, what's called indirect additives to food, that there aren't indirect additives that are unsafe. So they're watching for that. An example of that is they have a market phase out of grease-proofing substances containing PFAS in cookware. So what I'm going to be focusing on today is more this other role of food safety from an ingredient and nutrition perspective. And so we'll be drilling down into that role. So for food ingredients, every ingredient in your food, the FDA has approved it to be there. And they do this approval process by first classifying foods as either ingredients as either generally recognized as safe or as a food additive. And the sort of the standards around each of these classes of ingredients varies a little bit. It's how they look at the safety. A generally recognized as safe ingredient, GRAS ingredients, to be considered GRAS, all data necessary to establish safety must be publicly available, and its safe use must be generally recognized by qualified experts. It also has to be, there has to be reasonable certainty that there will not be harm from this ingredient in the way that it's intended to be used, the kinds of foods and amounts that would be put in those foods. And examples of GRAS ingredients are like canola oil, vinegar, salt, and more. It is possible that once an ingredient has been classified as GRAS, that it can be removed from that list and handled like a food additive, for which there's more regulatory control. For GRAS ingredients, manufacturers really can basically put it in any food they want in any amount. If it's a food additive, there's limitations. Food additives are basically, I mean, it's kind of complicated to explain, but this is a primer, so I'm going to just say, that it's basically ingredients that are not GRAS ingredients are considered food additives. And food additives are classified as either direct additives, and that's the manufacturer intended to put this in the product, or an indirect additive, where it comes from the packaging and sort of not meant to be added to the product, but from the packaging, it leaches into the food product. The direct additives are what you see on that ingredient statement on packaged foods. And here the manufacturer, before they can put it in the product, they have to petition the FDA and with information that provides, that indicates that it is safe. They have to provide evidence of the safety for the ways they intend to use it in food products and in the intended levels they plan to put into it. So think of a list of non-nutritive sweeteners like aspartame. A petition had to be filed with evidence of safety in the amounts that one would put it in various foods with aspartame. So there has to be science to support this, reasonable certainty of no harm. The FDA reviews this evidence, and if they approve it, they go through kind of a complicated process to really figure out exactly how much could be put in a food product. And they have limits, caps on how much of, say, aspartame can be put in, say, diet sodas. Now look at this label here and what I just described. Do any of these ingredients look to you like they might be considered additives? And I know you're not experts here, so I'm just asking you to kind of look and think, any of these where you think, gosh, I wonder if this is probably an additive and not a GRAS ingredient.
Natural flavoring.
Interestingly, natural flavoring. I would think that too. It's actually, it is actually GRAS.
Oh,
Yeah. Any others? Yeah, it looks like it would be additive, but it's actually also a GRAS ingredient. So this is the kind of the point is there's a lot of things that are GRAS ingredients that you think it wouldn't be. Definitely GRAS. So the one I wanted to point out here, no one mentioned it, but potassium salt. Until I think just last year, it was called potassium chloride on labels, and the FDA recently changed how it's described on product ingredient statements to be potassium salt instead of potassium chloride. Any guesses on why the FDA made that change and how this is described?
Maybe the average consumer doesn't know it's sodium. Potassium, sodium, yes, salt, table salt.
We're really close to it. So salt, which is on the ingredient, is actually sodium chloride.
Sodium chloride.
Yep. And potassium chloride is being used as a salt substitute to help lower the sodium content of the American diet. So manufacturers are being encouraged to put potassium salt in products, but the consumers were afraid of it when it's called potassium chloride. It sounds scary. Potassium salt sounds less scary. So they made this change for that reason. All right. Now, another part of the FDA's mission is related to making sure the public gets accurate science-based information they can use for foods to maintain and improve their health. And that FDA has a long history of doing various things for this purpose, starting in 1938 with the Food, Drug, and Cosmetic Act, which required that products have an ingredient statement where we know what ingredients are in our foods. And the ingredients are listed in descending order of content. So the first ingredient would be famous by weight, the most in the food, and the last ingredient would be the opposite of that. And then in 1990, the FDA, the Nutrition Labeling and Education Act was signed into law. And this requires that nutrition facts panel be on all packaged foods so that you know its nutrient content for key nutrients. And what's required is that you provide the grams or milligrams of the nutrient and the percent daily value, which is like the percent of your total daily requirements for that nutrient. And so for this Campbell soup here, it is a good source of potassium and vitamin C, which is great, but then one also sees, oh gosh, it's kind of high in sodium and added sugars, which isn't so great. So the consumer can look at this to try and make sense about the food for their health needs. In 2004, the Food Allergen Labeling and Consumer Protection Act was passed, and this requires that products list major food allergens in the ingredient statement in a way that consumers can identify. And so here you see contains wheat. So if you have a wheat allergy, you would really appreciate this on labels. In 2014, the FDA requires that the nutrition facts panel include, restaurants provide calorie information on restaurant menus. Here at the University of Minnesota, a group of us did the first randomized trial evaluating whether putting calorie information on the restaurant menu would change food choices and calorie intake. And that data was helpful to the FDA considering whether this would be passed or not. It contributed to the evidence base on which this regulatory decision was made. If you completed the fun quiz ahead of time here that I gave to those early arrivers, you're probably wondering how effective is this? The question I asked is how effective do we know this policy is? At this point, there's been quite a few studies evaluating, now that it's been rolled out nationwide, the effect it's having. And it is having, appears from studies to have a small effect on the energy intake from restaurant meals. It's a small effect, but could be important from a population perspective, is the conclusion from a recent meta-analysis on this topic. The FDA is doing lots more too, like there's health claims that are allowed on the front of product packaging and limits on what you can say about foods on packaging. But the industry seems to always be trying to get around, the limits that the FDA has, so the FDA has to keep changing it up. And the most recent one that really annoys me is uncured bacon. So what things about on the package here make you think, gosh, this might be okay for me? Could be healthy.
Natural.
Natural.
No artificial ingredient.
No artificial ingredients, 100%.
No nitrate. No preservative. Minimally processed.
Yeah, a lot of indicators here that make you think it's okay. What I find most unsettling is, our advice to Americans is to limit intake of cured meats. And they're saying it's uncured. And they're saying it's uncured because they have not added nitrates or nitrites to it as an ingredient. But they are using celery. What's the ingredient? Celery powder. Celery powder is rich in nitrates. So for consumers, they don't know. I mean, how are they to know?
So they're making that claim because how can they do that?
Well, technically, it does not contain nitrates or nitrites, and the FDA will probably needs to do some regulatory move to say that, that nitrate containing ingredients would negate you being able to say this.
So because celery powder is not on that list, they get around.
Well, it's on the list of, probably it's a grass ingredient.
No, I mean on the
Right,
nitrate list,
Right, it's not technically a nitrate or nitrite. So yeah, so this is an example of where there's, the industry, they're trying to market their products and they find the little holes they can to get around FDA regulation. And this is a good example of that. What's coming down the pipeline is front of package labeling so that you don't have to turn the package to the side to see the nutrition facts panel. It'll be front of pack. It'll have the big debate is which nutrients are you going to include on it and how are you going to display the information that's most useful to the consumer? And that's what they're working out. And this may come in 5 or 10 years. Like the one thing that as I talk through these regulatory changes, they may take 10 or 20 years to come to fruition. I give the FDA a lot of credit for persistence and slowly plugging along across various administrations, and whatnot to get things through regulatory measures through. Now let's move on to this. So that's the kind of a primer on FDA and food regulation. And now let's move into the key role that sound scientific evidence plays in regulatory decision making. At that conference I was at in December, I talked to the head of the food section of the FDA, and she was telling me just how limited they are, and even in published studies, the ones that they can consider as part of their evidence base. You need to make sure when you're writing your papers that you have your methods well described, because they look for certain features to indicate, to identify the quality of that publication to decide if it can be used in their scientific evidence base. And she basically said, if your research meets the criteria the Dietary Guidelines for Americans Committee has for nutrition studies to be considered as part of the evidence base for the Dietary Guidelines for Americans, it would meet the FDA requirements. So as you write papers, that's something to keep in your mind, that it's going to be eligible for use by FDA in their decision making. The kinds of questions they need answered, these are examples, is a nutrient or food component protective or harmful to human health? They need a robust scientific evidence base around that. When they're looking at, then maybe it's going to be front of package labeling, what do we know about the effectiveness of different ways of displaying the information? Is the regulation apt to actually be effective, and for whom? And really importantly, are there some potential unintended consequences? Think about that, putting calories on restaurant menus. Can you think of what kind of unintended consequences do you think the FDA and others were thinking about when that decision was made? Any bad outcomes that could happen with that? Yes, Susan.
When I was a PhD student, there were calories on some of the menus, and I remember specifically ordering the highest calorie foods because I didn't want to spend my money on low calorie food.
Right. You might think that I'm going to get a lot for my money because I want to fill up. I don't have much money. And our randomized trial, we actually found that men use the information to purchase more calories.
Wow.
Other studies didn't find that, though. We were the only study, so it was really a fluke, but it could be something to it. Yes.
Some people don't know what it actually means, so they might look at it and see that their iced latte has 400 calories and think, oh, that's not so bad.
Right, like what does the number mean? There's no reference, so people don't know the daily calorie requirements, right? So, was it right to just, there is supposed to be a footnote where somewhere on the menu it says that this is in reference to the 2,000 calorie diet, but personally, I think the restaurants have really gotten around this because their menu boards, fast food restaurants, if you've been there, they flip around, they move around. Your eyes can't even see the calorie information. You're barely seeing the price, and yeah. So yeah. The only other concern that you guys did not raise about this was there's two other concerns. One is that people with eating disorders, that they're told not to pay for calories, and now we're just putting it right out there in front of them. And another is that this increased food costs, because ultimately these restaurants pass on the cost of the labeling to the consumer. And if I'm a consumer not using that information, I'm paying for something that I'm not using. And there's a lot of concern that maybe the people who would use this information are well-educated, upper income people, and that lower SES folks are paying the cost of this for us, like, that's the kind of thing that the FDA thinks about. And when we do studies, we have to measure what are the potential unintended consequences. All right, so let's jump to some regulatory success stories, and I'll weave in some U of M research that's contributed to these success stories. And I think the biggest, before I go there, I want to acknowledge that the research I'm going to be talking about, a lot of it was done by supported by our university's Nutrition Coordinating Center that supports nutrition research by providing software and databases for nutrition assessment. And this is our small but mighty team. And I know we've got Julie, I think, is here. Raise your hand. Julie is the director of operations at NCC, and advocates, directs the center along with me. So just a shout out to this team. So success story number one is that the FDA banned partially hydrogenated oils from the US food supply. They are no longer in any of the foods you buy. You don't have to look at the label, it's just gone. And why are partially hydrogenated oils of concern? What's the health concern with them? You even know. Trans fats. So they're the source of man-made trans fats, and trans fats have been found to increase risk of coronary heart disease. They have a double whammy of increasing LDL cholesterol levels, that's your bad cholesterol, and also lowering HDL, your good cholesterol in your blood. So worse than saturated fat actually is what the research suggests. And so interestingly, partially hydrogenated oils were on the GRAS list. They were generally recognized as safe. When the science came out around the health concerns, they actually, it took a while, but they removed them from GRAS and actually moved them to be an additive that they deemed unsafe to have in food in any amount. So it's gone. No one has to worry about, even though the label does have trans fat on the nutrition facts panel, you really don't need to read that because it's just been taken care of through this great public health measure. So how do we get here? I mean, this is amazing. And actually, a lot of people don't know that this has happened. They're still worrying about trans fat. They're avoiding margarines. How many of you knew this already? So about half of you, and the other half didn't, right? And we're in public health, right? So things that the university did to sort of support this work around trans fats. And one is that in 1999, we added trans fatty acids to our database so that researchers could actually assess intake of trans fat to study it, and for us to know the level of exposure in the population. And so that was a cool thing that was done here. And my first NIH grant was actually then using that data to look at trends in trans fatty acid intake using Minnesota Heart Survey data, which was a repeated cross-sectional survey of adults in the Minneapolis metropolitan area to assess risk for heart disease. And we had collected 24-hour dietary recalls over decades, and I was able to, get trans fat data back to the past because the way our database is designed is really cool. You can actually use your old data and get nutrients for new nutrients we've added. So anyway, we were able to look at this. And here we see trends in trans fatty acid intake in grams per day for men and women over this 15-year period. And what you saw is that between 1980, 82, and 95, 97, intake was going down notably for trans fat. Any thoughts on, and this was before the ban on partially hydrogenated oils happened, any thoughts on why it was declining over this time period?
The fat-free movement.
Right. Part of it was that people were just eating less fat overall, and that would affect all fatty acids. When we look at this as a percent of total energy, it also went. That's a part of the explanation, but not the total explanation. There's another factor as well. What's
I
that?
started putting something else in the food supply.
I
don't know what it is.
You're on it.
I'm like,
What happened is that the science was starting to come out. Consumers started to get worried about trans fats. They were looking for partially hydrogenated oils. There was recommendations coming out from organizations like the American Heart Association saying, avoid trans fats and encouraging manufacturers to reformulate their products. And manufacturers started voluntarily reformulating their products to remove trans fat or partially hydrogenated oils and in turn trans fat. And that, helped consumers.
Can I ask a question?
Yeah,
Why were men consuming so much more trans fats, especially early on?
they just eat more calories overall, so then they have more of all kinds of nutrients. As a percent of energy, it would be similar between males and females. Good question. But even in 95, 97, reformulation is happening, but still this is about, 6 grams of trans fats. That's about a teaspoon of grams of trans fat a day. So it's still, a substantial amount, even with the declines happening. One of our students, Matt Albers, he in 2006 looked at trans fat content of margarines and butters, cookies, snack cakes, savory snacks to see in the marketplace, like what's the trans fat look like? Is the voluntary efforts to reduce this working? And he found that at that point in 2006, most of the products were free of trans fat or had very little, but some still had it in big amounts. So it hadn't completely gone away from the food supply. And those kinds of data help, the FDA realizing like we need to actually remove this from grass and ban it from the food supply, because not all manufacturers are doing this voluntarily. We had a student, Cecily Weber, and more recently she looked at margarines in the NCC Food Industry Database post the ban to see, is it true? Are they really gone? Are manufacturers complying with this ban? And now how do margarines look compared to butter? Maybe they just reformulated the margarine by just adding hydrogenated oils, and it has as much saturated fat as butter, which, is great. And what she found is that all the margarines are now trans fat free. There's full compliance for the 100 and some margarines we looked at here. And they are still lower in saturated fat than butter. So if we believe that saturated fat should be limited in our diet, we should be choosing margarine over butter. That's the take-home message. And we knew that we did this analysis because we knew that a lot of dietitians, health professionals, the public actually didn't know that this ban had taken place. And this would be a chance to educate those folks. So we did some news coverage around this, some media interviews. And recently we found that it was used in a policy decision, which is really exciting, in Iowa. In 2023, Iowa State Representative Jeff Shipley introduced a bill that would ban margarine from school lunches due to its trans fat content, with butter serving as its replacement. Emily Piper, representing the Iowa Association of Schools, cited our study as evidence that margarine has less saturated fat and less trans fat than butter. She said, so I guess if we're going to make an assumption about whether or not butter or margarine is an oil of choice in a school, we ought to at least be basing it on research to talk about which one is better. So good for her for, finding this article and using it. And this bill was not passed. So regulatory story that's in progress and that I hope will be a success story, but we're not there yet, is around sodium. Currently, sodium, salt, and other sodium-containing compounds are classified as GRAS ingredients, so they can be reused freely in foods, in any amounts, any food, basically. But the FDA is considering changing that. They're considering removing salt from the GRAS list and making it an additive, and then they could limit how much is added to foods. So they could say, for soups, you can't put any more than so much in it. They probably do it by different food product categories. Snack chips, you can only put this much in. And they're considering this because we know that Americans consume way more sodium than is recommended, and it's a persistent problem. And here's some data from the Minnesota Heart Survey. Postdoc at the time, Katie Meyer, published this paper looking at trends in sodium consumption over time. And this shows between 85, 87 through 2007, 2009. You see the sodium intake levels for men and women. The recommended intake level is 1,800 milligrams per day. So you can see this is well above that. These are means. And no improvement over time, even though we've been telling Americans for decades to limit the sodium in their diet. So why do you think our messaging has been ineffective?
It tastes bad when there's no salt in it.
When it tastes.
I'm not even joking. I think it's true.
When you remove fat, if you remove fat and you don't have salt, it's really bad.
So our taste palates are used to the saltiness, and I think I heard Jennifer say, you said, food supply.
Yeah, I mean, you could always add salt, like we've all got salt shakers at home, but if the food supply doesn't change, then you don't have that opportunity to even, get loads of product.
Exactly. So that's a big question. Like, how do we approach this? Do we just, help people's taste buds adjust and just people add less salt to the table? Or is it something bigger like the food system that needs to be changed? And so the CDC actually funded a study to identify the sources of sodium in the American diet to figure out, should we be just advising people to use the salt shaker less, or do we need to go look at the food supply? And they funded this study that we were lucky to get the grant. Lynn Steffen was the PI. And we looked at sodium intake in 3 geographic areas in the US for a total of 450 people. They were chosen to be, diverse with racial identities, so we really would have some things, not nationally representative, but we actually have, at least have some diversity represented in the sample with different geographic regions and people with different racial identities. And what we found is that 71% of the sodium came from salt and sodium containing compounds added to food during commercial processing. Only about 5% was from added at the table with the salt shaker, and only 6% from salt you might add in home cooking. And this study was really complicated because our usual way of assessing diet with the 24-hour recall, we don't go into great detail about how much salt you added at the table or measure how much you used in cooking, but we had people collect duplicate salt samples. When they shake some onto some food, some salt on their food at the table, they also shake the same amount into a baggie. So we would know exactly how much they added at the table, and the same for home food preparation. We collected urine samples to get urinary sodium to validate our measures. And anyway, it was a really cool study to be involved with. And when I was at this meeting in December at FDA, I talked to the head of the nutrition section, and she said, "You won't believe how important this paper is to us in regulatory decision making." Before this, they were hanging their hat on a study that was done in 1991 that involved about 60 people in a small college town. They'd done this kind of analysis, and that was the only data they had to know the sources of sodium in the diet. And that was not going to be enough to hold up against pressure, say, from the food industry around this regulatory measure that might remove salt from grass and limit it in food. So, we also have done studies looking at changes in sodium in the food supply. The FDA has been working to encourage the food industry to limit sodium in foods. They tend to try voluntary efforts first, like, okay, do this voluntarily. And if you don't do it voluntarily, then we might have to do something different, like remove it from grass. So the industry has, a lot of food companies have pledged to lower the sodium in their food products. There's now analyses looking at how well they're doing that, and generally that's not very good. It's not really happening necessarily. And this was a paper published by our group. Again, a student led this and looked at trends in sodium content of fast food restaurant menu items over a 10-year period, during which some of these restaurants pledged to lower the sodium content in their food products. And really the take-home message was there was no real meaningful reductions in the sodium content of menu items over this time period. So this kind of data tells the FDA voluntary measures are not working, and that gives them what they need to think about more strident measures. So I'd say stay tuned on sodium, salt, to see if it gets removed from grass. And if you hear about that and petition things being done around this, now you kind of know what's happening and why. Now I'm going to talk about a couple emerging things that FDA is trying to tackle, because the food supply is always changing, new challenges. And one is the plant-based milks. They're exploding in the marketplace. And the FDA has to kind of figure out what to do about them. And one key challenge, one key issue is that some consumers may think that these plant-based milks are a nutritional match for dairy milk. And in fact, our own Senator Tina Smith was part of introducing a bill that was to what they described as combating mislabeling of non-dairy products. And what they said is that for too long, plant-based products with completely different nutritional values have wrongly masqueraded as dairy. And this is dishonest branding, misleading to consumers, and so this should be changed. And we need to protect our farmers and our dairy. So part of this is like, well, the people who put this bill forward are also in states where there is, the dairy farmers. And so part of this, you could say, well, they're just trying to protect farmers, but we actually do know that consumers are confused about this. And I'm going to share, I don't usually show anecdotes, but I have a really good anecdote with my son. He was totally duped. So in high school, he was, a runner, and his coach said, you should drink dairy milk. It's great. It's good source of protein, calcium, vitamin D, just what you need as you're a growing athlete. It's important. And then he went to college. He got his dream to run, at college. He was away from home, and I was talking to him on the phone one day, and he said that he was drinking oat milk. He'd switched to oat milk. And I think he thought I'd be proud of it. And I was like, oh. You find the ones that are calcium and vitamin D fortified, and like maybe you want, I think my dietitian kicked in, choose a different product that has no protein. He had no idea. He thought that it was just the same as nutritionally as dairy milk. So, and he's a college, pretty, his mom's a dietitian, and he's getting a college degree. If he's duped, many people are not understanding the difference. And so the FDA does not have a draft guidance for the industry that they've put out to start to figure out how to handle this. What Tina Smith and her crew were proposing was that instead of, if a product is not a nutritional match to dairy milk, it should be called a plant beverage or a plant juice or a plant drink. And only if it was a pretty good nutritional match could it be called a milk. And that would help consumers know if they're looking for something that's a nutritional match, look for it to be called milk. So we'll see where this goes. It's, again, it's probably gonna take years to figure this out and what's gonna happen, but.
Yeah, I could comment.
Yeah.
I was going to say if the dairy lobby has its way, and I'm a generation or two removed from the dairy farming family, and I know we're in the Midwest, but I'm going to say something probably that might be a little unpopular. The Dairy Council has its way, the dairy lobby has its way. We will have a new food group called Dairy Milk.
Yeah.
How did we have an entire food group of a protein beverage? That was political.
Right.
It
And
started in the 1930s.
Yeah. The food industry has had a lot of say in our dietary guidance system, right? Where we're at today, with dairy being our main source of protein and calcium and vitamin D in the American diet. Yeah.
Sorry to be facetious.
Yeah. No, it's sort of acknowledging the role of industry and things. So I want to do a shout out to Abby's paper that she recently published, actually looking at the nutritional content of different plant-based milk alternative products to see, are there some that are out there that are a pretty good match, that could be a good choice for someone who wants to get those nutrients or to get those nutrients. And that kind of the take-home message in the 219 products she looked at from 21 leading brands, and we have all those in our NCC database, so it's like we were able to access that data, was that most are not a nutritional match. There's a very limited number that are, but there are some that are, they're got good amount of protein, they're fortified with calcium and vitamin D to similar levels. And vitamin A is another nutrient that's in dairy milk that, but do you want to say anything, am I representing it okay?
Yeah, we looked at these 200 and some products, and I think depending on how you decide to match on nutritional similarity to cow's milk, we found like 6 or 8 that looked like they could be generally a pretty good match. And most of them were soy milks or some of these more plant blend type milk products that are being created that have pea protein and other sources of protein in order to match. Protein was one of the bigger nutrients where there was a lot of variability, but there were other nutrients that many people don't look at that we were able to look at because our database goes beyond what's on the label. And so some of the other nutrients that dairy sort of says that they have a lot of were harder for these plant milks to match on.
Yeah. Thanks for that better summary. And the one thing that's cool about these papers, this paper, and the others that we've done that are similar, is that it's also feedback to the food industry. Because they can see how their products are stacking up against others. And they can maybe see the writing on the wall. If it comes to pass that you can only call your product milk if it's a close nutritional match, then I'm going to start reformulating my product. And that's the other way that some of the FDA regulations improve the food supply is, not only informing consumers, but they can lead to product reformulations that are beneficial for us all. We did a lot of media interviews on this topic. There's a lot of interest, and we realized it was important to get this message out because consumers don't know, and health professionals don't necessarily know either. So you did a lot of interviews, and probably the one that I thought was the coolest was the Washington Post last March around March Madness. They actually created a little interactive basketball game between cow's milk and plant-based milks, and they say, oh, what about this nutrient? Which one's going to win, and they really conveyed the science pretty well, pretty accurately through this interactive game. Another emerging regulatory thing is around the plant-based meats. Again, they are, there's concern about can they be called so consumers aren't confused. And so the FDA has regulatory guidance around that's under development. And we did an analysis of plant-based ground beef alternative products available in the US to just sort of see how they're matching up nutritionally with key nutrients that Americans kind of depend on animal meats to provide to us, like protein, iron, zinc, vitamin B12. And we found that that many are not a nutritional match for protein, iron, zinc, and B12. But we did find that these can be a good source of some shortfall nutrients in the American diet, like fiber. A lot of these plant-based products are a good source of fiber, which is great. Oh, but then unfortunately, a lot of them have a lot of sodium, and they managed to formulate them with more salt than is ideal. So anyway, this is a feedback mechanism to the industry and information to consumers and the FDA about how these products are looking. There was one product that was eerily nutritionally matched to ground beef by design, I believe. Can anyone guess which brand of the plant-based product that would be if you're when somebody buys these products?
Impossible.
Yep, it's the Impossible Burger. They have fortified in a way that has as much or more of some of these key nutrients as ground beef. And what's kind of exciting about these is they have this ingredient called soy-like hemoglobin. And that's where the iron in this product is coming from, is from soy-like hemoglobin. And oops, my reminder to wrap it up. So we have time for Q&A. So iron that's bound to hemoglobin is more bioavailable. When you eat it, more of it will pass into your, prostate-intestinal barrier into your bloodstream to be used by your body. Non-heme iron, which is found in plants, is less bioavailable. Heme iron is only found in animal products, except maybe this, because they formulated the soy-like hemoglobin, it's actually bound to a plant source of hemoglobin. So I actually contacted the chief scientific medical officer at Impossible Foods and had a conversation with her, because before I published a paper, I wanted to know if they'd done any studies evaluating the bioavailability of the iron in their products. And they have not. So we don't know. But it's intriguing.
Where do they how do they make it?
You can go to their website and they'll show you that it's like they use a yeast and it's I can't describe it.
The yeast, like,
Impossible.
it has the genetic code from the root of the soy or the type of plant that does it, and then the yeast produces the like hemoglobin in the fermentation, right? I think that's how they do it, and then they isolate that.
Thank you for that's pretty close to what I do. And so that's how the Impossible Burger has kind of, it's like red and juicy, kind of like the blood you'd see in animal meat. They're getting that from that like hemoglobin. Yeah. So anyway, I'm going to start wrapping it up here and just say that if you're trying to figure out how can I come up with research questions that the FDA could use, I'd encourage you to follow FDA, CDC, USDA, NIH, see what's being discussed and talked about in their publications and at their meetings. That gives you a good clue as to where they're thinking about heading, what the needs are. Also, professional organizations like the American Heart Association is another great source. And I think what we're relying on is consumers. What do people out there think? What do they want to see done around food regulation? What do they think would be helpful to them? And we've underutilized that people in this process. And I'm going to wrap up by just saying something that people are really interested in right now, and the FDA is trying to address, and scientists are interested in this too, is ultra processed foods. This is a cover story from Newsweek on this. And here you can see that I realize they're recommending a warning label. I've got a warning label here. And so at the meeting in December, there was a whole session held on ultra processed foods, talking about where the science is at, what kind of science do we need. And the head of nutrition at FDA, what she said is that they do not have plans at this time to regulate ultra processed foods because first of all, there's no consensus on the definition of what an ultra processed food is. So how would they ever put warning labels on if we scientists can't agree on what it is? And that's true. We don't really have a unified definition of what an ultra processed food is. There's not enough scientific evidence indicating that all ultra processed foods are bad for health. We've got mostly observational studies that have not always controlled for confounders like, separating, like, is it just added sugars, salt, those sorts of things that are causing the harm versus some other ingredient in ultra processed foods that's to blame. And ultra processed foods, it encompasses like your yogurt. If you buy store-bought bread, they're pretty much all classified as ultra processed foods. It's a pretty big deal to, be broadly label all kinds of different foods ultra processed if we're not really sure on the science on this. I think you just mentioned this already, that there could be, there's really a need to know, like, what is it in these products that's inferring harm? Because ideally you would focus in on those ingredients. Is it certain things like guar gum, thickening agents, or is it the non-nutritive sweeteners, or is it artificial colorings or flavorings? Ideally we would get down to figuring that out so that we aren't mislabeling some foods as inferring harm when they're really not. And we're really not sure about the adverse consequences of regulation yet. The concerns are that manufacturers, and they're already doing this, they're coming up with clean labels, removing ingredients that could shorten the shelf life of the food. And shortened shelf life is more food waste. It's more of your food dollars being wasted, and that could worsen food security for folks who are, experiencing trouble buying enough food for their household. Could result in higher food costs if foods have less shelf stability. That costs more for grocery stores who have to turn food over and whatnot. And there's also concern about greater time spent in home food preparation, because imagine, I think I have to make my own homemade bread. And today in the American society, women are still primarily, have a greater duty for meal planning, food shopping, and home food preparation. So that's something, these are the kind of unintended consequences they're thinking about and that we need data on. And just before I wrap it up, getting this ready and seeing that, it reminded me of one of my first papers published as a postdoc here. I was a postdoc in the division. I used national survey data to look at who in U.S. households is most responsible for meal preparation, food shopping, meal planning. And at that time, it was mostly women. And that remains true today from more recent data. And this was back in the day when journals were hard copy. It's 1998. Journals would be hard copy, and they would have artists who made renditions of, like, one of the articles in the paper would have some kind of artistic rendition. And my paper was chosen for that artistic rendition. I don't know why they put them, it kind of conflicts with our findings. Not that much involved, but the aspirational, I guess, and then would be more involved. So I'll end on that fun note, and I'll take questions and answers. And also I have I'm going to do the door prize now, so I don't forget to do it. For those of you who did the quiz, one of you will have has one that has a pink dot on the back side of the quiz. Oh. You are the winner. I'm telling you this. And then I also have some door prizes for everybody as you leave, some NCC Post-it notes and some chocolates that you can take. I'll put them out before, grab before you leave. But, questions or comments, thoughts? Yes.
I guess I'll just be glad. I love this so much. This is so cool to see this, something I've thought very little about. And I have to say, it's refreshing to have this divorced from current politics, even though it's obviously related, but like to not mention the current situation, that felt really good. Thinking about how this stuff should work. How do FDA and regulatory scientists think about nonlinearities in these things? Because I assume when we're talking about nutritional content, it's sort of pound for pound. But regulation changes then how much people consume of what, right? So I don't know about plant-based milks, but I buy a fair amount of impossible meat, and I think it's a lot more expensive than beef.
It is.
And so as a result, I probably eat less than I would beef. But I assume the nutritional equivalence is not based on like the average consumption or discounting of how much it costs and how much these things, right? So like how do regulatory scientists think about that aspect?
Yeah, it's really, you're raising the complexity of it. One thing is that we have this National Health and Nutrition Examination Survey, NHANES, which we talked 24-hour dietary recalls from, representative sample of Americans. And one can kind of look and do some simulations and see like what if these, you can kind of look at the real world of, people eating Impossible Burgers, what are they eating and how's, what's their nutritional intake? But you could also do simulations to see if substitutes were made, how would that affect nutrients in the American diet and the percent of people who fall below recommended intake levels of nutrients. Or above levels, nutrients have this, most of them have a range where too little is bad, but too much is bad too. And we're wanting to keep people in the sweet spot of where it's a healthy amount, and we can kind of look at that using NHANES data to do that. Yeah, Jennifer.
Yeah, I agree. That was wonderful and fun and cool to look at, all those data and points about nutrients. But I noticed with the salt and sodium guidelines that first bulletin on we're going to look at this, I think was dated 2007. Is that a typical time frame for these kinds of changes? Because it hasn't changed yet, right?
No, it is. It takes decades. And at that meeting I was at, I just came to appreciate the diligence of the FDA people who just, you think they want to give up, but they plug along through various administrations. And it is a hopeful thing that, we can have rough times for public health and our ability to do kinds of things we think are beneficial to the public health, but time passes, the agencies work away at this, and our science helps contribute to it. So yeah, it's not unusual for it to take a long time. Yes.
Is there any, this may be tangentially related, is there any regulation about like packaging for food products? And is that an FDA thing? Because like when you're talking about what is the consumer thinking about when they're going to the grocery store, what are they concerned about? Like when I go to the grocery store, one of the things that I'm thinking about is like, I want to buy things that aren't wrapped in plastic. And like everything you buy at the grocery store is just like 6 layers of plastic. Is that something, is that through FDA or?
Yeah, really good question. They do care about packaging, but only not from an environmental perspective. Like I just want to avoid plastic, like it's end up in the ocean and it's, those kinds of reasons. They're more interested if, imagine that plastic has some chemical in it that leaches into the food and that we think infers harm. Like they're really kind of laser focused. They call them indirect additives. So like biphosphol, please pronounce the BPA. They actually said you have to change the lining of your can so that it says have this little type of lining that contains BPA, which they worried might or harm. So.
Yeah, thanks, Dr. Harnack. 2 questions. One is, I'm curious about like your thoughts on nutrition labels that other countries, like their models, especially like Chile and Mexico, have done like really incredible, regulation around labeling. And I'm curious if you think the FDA is looking at those models as potential directions that we could go to. I forgot the second one, so just that one.
That's actually a really, really good point. In some ways, some other countries are way ahead of us in how they are labeling foods and warning consumers about, like there's health nutrition warning labels in some other countries for added sugar. And we do not have that, and I think the FDA kind of thinks, well, that's not politically possible here in the US. And so they're not necessarily pursuing some of those things, even though research suggests they may be effective in other countries. In some ways we're behind other countries, other ways we're at the forefront, like with the trans fat ban. We're working, NCC's been collaborating with some researchers in Nigeria, and Nigeria is looking at, phasing out partially hydrogenated oils and sort of helping them assess that policy. So there we're ahead, on that, but they're behind in other ways. So it's a really good question. Yes.
I don't know if this is true, but I feel like when I was in Brazil, people told me that palm oil, which is like a really traditional cooking ingredient, is actually trans fat. No. Okay, well, that's not really my question. My instance is when there's a certain ingredient that, despite the best of intentions, gets kind of demonized. Is there ever an instance where like a cultural group or a group where that's like a really traditional part of their food culture has pushed back and that becomes debate?
Right. I'm going to start with the palm oil because that is a good question. Palm oil there's a couple tropical oils that are high in saturated fat. And I should say that there is naturally occurring trans fats in a lot of fats. The naturally occurring is usually really small amounts, and that we don't believe we're too worried about that from a health effect. So actually palm oil might contain a small amount of trans fat that's naturally occurring. But there is concern that we sometimes, come up with dietary recommendations that are not taking into account the very eating traditions that exist. And we're trying this one size fits all, not recognizing that maybe not every group needs to eat dairy because they tend to eat a food that provides calcium, vitamin D, and protein through these other foods that are different parts of the eating tradition. And that is something that the Dietary Guidance for Americans is trying to work towards figuring out how to make sure that's taken into account versus ignoring or demonizing certain eating patterns. All right, I think we might be, thank you everyone for coming today, and I'm going to get the door prize out so you can take it as you leave. So. It is the